There is a moment that happens quietly in the body after 60, and most people never feel it. The same pill you've been taking for years, the one your body tolerated without any issue, can suddenly begin to behave differently. Not because the pill changed, but because your body did. And in some cases, that difference is not small. It can mean the difference between protection and risk, between stability and a slow buildup towards something much more serious, like a heart attack or a stroke. What makes this especially dangerous is that nothing feels wrong at first. No warning sign, no pain, no clear signal, just a silent shift. And today we're going to talk about 5 specific types of medications that after the age of 60 have been linked to an increased risk of cardiovascular events, especially when certain conditions are present or when they're taken the same way they were years earlier. But here's the part that matters most. This is not about fear. This is about understanding what's actually happening inside your body so you can make better decisions moving forward. My name is Dr. William. I'm a medical doctor and physician, and on this channel, I break down complex health topics into clear, practical explanations so you can better understand what may be happening inside your body and what actually makes a difference over time. If you find this kind of information helpful, you can subscribe. But more importantly, stay with me through this because one of the medications we'll talk about today is taken daily by millions of people and almost never questioned. Now, to understand why these risks increase after 60, you have to start with something most people are never told. Your body does not process medications the same way it used to, and this is where things begin to change. As we age, several systems in the body start to slow down. The liver, which is responsible for breaking down many medications, becomes less efficient. Kidneys, which filter waste and excess substances from the blood, also lose some of their filtering capacity. That means drugs stay in your system longer, sometimes much longer than expected. And when that happens, even a normal dose can begin to act like a higher dose over time. But that's only part of the story. There is also a shift in how your blood vessels respond. Your arteries become less flexible. The inner lining of your blood vessels becomes more sensitive. Circulation patterns change, and the balance between clotting and bleeding becomes more delicate. So when a medication interacts with any of these systems, the effect can be amplified. And that's exactly where we're going next. Sometimes the most difficult part of aging is not what we see in the mirror, but what we do not feel happening inside the body. You might still feel fine, still follow the same routine, still take the same tablets you have trusted for years, and yet something subtle begins to shift beneath the surface. Have you ever wondered why some people suddenly develop complications, even though nothing in their lifestyle seems to have changed? Or why a medication that once felt completely harmless starts causing new side effects out of nowhere? These are the kinds of questions that rarely get answered in a way that truly makes sense to everyday life, yet they matter deeply for your long-term health and independence. Before we go further, it's important to ground this conversation in clarity and trust. Name: Dr. Natalia Wright. Channel name: Dr. Natalia Wright, Senior Health. This is where we begin to connect medical understanding with real human experience, because health in later life is not just about lab reports or prescriptions. It is about how your body responds in daily living, how your energy feels when you wake up in the morning, how steady you feel when you stand, and how confidently you move through your day without unexpected limitations. And as we explore this together, I want you to reflect on your own life for a moment. Have you noticed small changes in your energy levels recently? Maybe a bit more fatigue than before, or recovery taking longer than it used to? Or perhaps you have started wondering whether the medications you rely on daily are still working the same way they once did. Because what we are really talking about here is not just medication, but adaptation. Your body after 60 is no longer the same internal environment it was at 40 or 50. It responds differently to stress, to rest, to nutrition, and yes, to medication. And when we stop adjusting our understanding along with these changes, that is often where silent risk begins to build. So as we move forward, I want you to keep one question in mind. Is my current health routine truly aligned with my current body, or am I still living by an older version of myself without realizing it? Now, as we continue, it becomes important to look at how everyday medications interact with this changing internal environment, because what once supported stability can, in a different stage of life, quietly contribute to imbalance if it is not reevaluated with care and awareness. One of the most overlooked truths in senior health is that risk rarely arrives suddenly. It develops gradually through accumulation. A small increase in blood pressure that goes unnoticed, a slight change in kidney efficiency that is never tested in detail, a medication that is continued year after year simply because it was started long ago. And slowly, these small factors begin to overlap. This is where the real conversation begins, because understanding these overlaps is what allows you to regain control before problems develop rather than after. And so, as we move deeper into this discussion, I want you to stay with an open mind, not a fearful one, because the goal here is not to make you anxious about what you are taking, but to help you see what your body may be communicating in quieter ways so that you can respond with wisdom instead of assumption and with awareness instead of habit. One of the first places this quiet mismatch between medication and body begins to show up is in something many people consider completely routine: pain relief. A simple ache in the knees after walking, stiffness in the lower back in the morning, or discomfort from arthritis often leads to the same familiar response: reaching for an anti-inflammatory tablet. For years, it may have worked almost perfectly. A single dose, relief within an hour or two, and life continues without interruption. But what often goes unnoticed is not the relief itself, but what the body is being asked to manage underneath that relief. As the body moves beyond 60, the systems responsible for filtering and balancing medications do not lose function all at once. It is not a sudden breakdown. It is a gradual reduction in efficiency that often goes unnoticed in routine checkups. Kidney filtration slows slightly. Liver metabolism becomes less predictable. Fluid regulation becomes more sensitive to small disruptions. And in that environment, medications that were once well tolerated begin to stay in the system a little longer than before. Not enough to cause immediate alarm, but enough to slowly change the internal balance. This is where common painkillers, especially anti-inflammatory drugs like ibuprofen or similar medications, become particularly important to understand. They are not dangerous in the way people sometimes assume when they hear warnings online. In fact, they are extremely effective and have helped millions of people maintain mobility and independence. But their mechanism of action interacts directly with systems that become more delicate with age. Inside the body, these medications work by reducing inflammation through enzyme pathways that are also involved in protecting the lining of blood vessels and supporting kidney function. When that protective balance is slightly altered in a younger body, the system compensates easily. But later in life, that compensation becomes less flexible. Blood vessels may tighten a little more easily. The kidneys may retain a bit more sodium and water than before. Blood pressure may respond more strongly to the same internal shift. What makes this particularly important is that the person taking the medication often feels only the intended effect: less pain, more mobility, more comfort. There is no immediate signal that anything else is changing. Blood pressure does not announce itself rising in real time. Fluid retention does not always feel dramatic at first. It may simply show up as slightly heavier legs in the evening, a bit more fatigue when walking uphill, or a subtle increase in blood pressure readings that is easy to dismiss as normal fluctuation. And so the pattern continues quietly. The medication is taken when needed, sometimes a little more frequently over time, as aches become more common with age. The body, meanwhile, is adjusting in the background, working harder to maintain equilibrium under conditions that are no longer identical to those of previous years. This is not about alarm. It is about awareness of accumulation, because what matters most is not a single dose or a single day of use, but the repeated interaction between a changing body and a consistent external input. A very similar story unfolds with another group of medications that many people associate only with stomach comfort and digestive relief. These are acid-reducing drugs, often taken for heartburn or reflux. For many individuals, they begin as a short-term solution during a period of discomfort. A stressful period, a dietary change, or a temporary irritation leads to symptoms, and a medication is prescribed or purchased for relief. The improvement is often so noticeable that the medication continues far beyond the original issue. Over time, however, the role of stomach acid in the body becomes more relevant than it first appears. Acid is not simply about digestion or discomfort. It plays a central role in the absorption of key nutrients that support cardiovascular and neurological stability. Magnesium, vitamin B12, and calcium are all influenced by this environment. When absorption changes gradually over months or years, the effects are not immediate or obvious. They appear as subtle shifts in energy, muscle function, nerve sensitivity, and in some cases, heart rhythm stability. It is not uncommon for people in later life to experience episodes of fatigue that feel slightly different from ordinary tiredness, or moments of lightheadedness that come and go without a clear explanation. Sometimes there are sensations of irregular heartbeat that are brief and resolve on their own. These experiences are often attributed to aging itself, or to stress, or simply to a bad day. Rarely are they traced back to long-term nutrient balance shifts that develop quietly over time. There is also another layer that deserves attention. The inner lining of blood vessels, known as the endothelium, relies on a delicate biochemical environment to function smoothly. When that environment is altered gradually, the ability of blood vessels to relax and respond appropriately can be affected. Again, this does not create sudden symptoms. It creates a slow change in resilience. What makes this particularly important is the psychological side of long-term medication use. When something is prescribed for relief and it works, it naturally builds trust. That trust becomes routine. The routine becomes identity, and over time, questioning the need for it can feel unnecessary or even uncomfortable. After all, if nothing feels wrong, why change anything? But the body does not operate on the basis of comfort alone. It operates on balance, adaptation, and constant recalibration. And when one variable remains unchanged while everything else slowly evolves, a mismatch can develop without clear visibility. This is where the conversation often becomes more personal than clinical. Because if you think about your own experience or someone close to you, there is usually a moment when medication use shifted from something temporary to something continuous. Not intentionally permanent, just uninterrupted. And that uninterrupted continuity is what often escapes review. Now consider how this connects with something as simple as daily movement. Many people in later life begin to reduce physical activity without fully realizing it. Not because they decide to, but because small discomforts accumulate. A little joint pain here, a bit of stiffness there, slightly reduced energy after exertion. These subtle changes naturally lead to more sitting, more rest, and less spontaneous movement throughout the day. When that reduction in movement combines with medications that also influence circulation, fluid balance, or nervous system activity, the overall effect becomes more layered. Blood flow is not just about the heart pumping, it is about muscle activity supporting circulation. When movement decreases, circulation efficiency changes. When medications influence vascular tone or fluid balance at the same time, the system becomes more sensitive to imbalance. And again, nothing dramatic needs to happen for risk to gradually increase. The body does not require a crisis to begin shifting its baseline. It adapts continuously, even in silence. This is why understanding medication in later life cannot be separated from understanding lifestyle, physiology, and time itself. A tablet is never acting in isolation. It is always interacting with a living system that is changing from year to year, sometimes in ways that are not immediately visible. There is a tendency to think of health as stable unless something clearly goes wrong. But in reality, stability is something that must be actively maintained through ongoing adjustment. And when adjustments stop, not because of neglect, but because everything appears fine, that is often when subtle imbalances begin to form. What becomes empowering in this realization is not fear, but perspective. Because once you understand that change is continuous, you also understand that review should be continuous. That does not mean frequent disruption. It means occasional reflection. A moment to ask whether what was appropriate years ago is still appropriate today. And as this awareness deepens, the conversation naturally shifts from reacting to problems toward preventing them long before they become visible.